So my name's Holly Paris and I'm the service lead for an innovative service that's been set up just in the last 8 weeks here in Weston Super Mare. It is a centralised care home team. It's a multi-disciplinary team and it's made up not just of primary care but actually of a number of different colleagues that work together under single clinical leadership. That's me. So in my team, I have a number of GPs. They're focused at the moment on doing turnaround work. They're GPs who've got a particular interest in the frailty of old age and in care home work. So they're engaged in work to ensure that those residents in care homes actually are looked after and have been sorted out as their journey has progressed through their life. So we often find that those patients in care homes have complex medical needs. They're often on many medications and they often have problems that are unaddressed. So my GP team are focused on doing turnaround work which involves a comprehensive geriatric assessment. The pharmacy team then are also involved and undertake structured medication reviews, looking for medications in particular that cause problems in people with advancing age and frailty. So they'll often stop lots of those medications. One thing that's really clear is when a patient's on 5 medications or more, usually one of those medications or 2 of them are actually being prescribed because of side effects caused by others that they're on, and we call that cascade prescribing. So we're on the lookout for that. We're on the lookout for drug safety issues. We're on the lookout for drugs that interact and actually cause new problems for older people, and that's the role of our pharmacy team, to work in an integrated fashion there. Alongside that, we've got some community nurses who are specialist care home nurses, and they will undertake comprehensive geriatric assessments too, but one of our team has particular expertise in dementia care and the behavioural care for patients who have challenging behaviour. So she will often go in and do a focused assessment around that to help care home staff better manage their residents and understand why it is that their behaviour may seem challenging. We also have a member of our community care home team who has special role in safeguarding and checking that care homes feel safe and secure in terms of their training. They work very closely with the local council, their compliance. So her job is to ensure that care homes are well trained and any training gaps can be addressed. And she's also involved in a lot of quality improvement methodology work. So in Weston Super Mare we have a large number of care homes. In fact, Peer Health Group, the primary care network that we're working for, looks after 72 homes. So to put that into proportion, Bristol has a quarter of the number of homes per head of population than Weston Super Mare. So there's loads of homes here. And the difficulty is that this is a seaside town that's difficult to recruit to. It's not a particularly popular place for people to come and work. So we have a problem of recruitment, but also a problem of lots of care homes to look after at scale. So what we were looking to do really was find an at-scale solution to an at-scale problem. So for some time, this has been a problem that we've been puzzling over how to solve. An at-scale problem needs an at-scale solution. So for some time we were thinking about how we could cooperate and collaborate, how all the practices could join together with their community nursing services and the mental health services to provide an equitable cover across 72 homes. And that's taken quite some work, and actually strangely COVID was the catalyst to getting us to work together. It was quite clear that doing the same thing over and over again and expecting things to be different wasn't going to be the way that we were going to improve things. So in fact it was all down to local relationships and cooperation between senior colleagues who actually know each other well and have been working together, coming together with a single vision to say, let's solve this problem together. it makes a difference working in this way for GP practices, because I think one of the major issues in primary care at the moment, and particularly in the post-COVID environment, is the amount of work that there is to do, but also the continuity that we can provide. And I think having a single team that looks after care home populations week after week, day after day, and seeing the same faces over and over again is really what's in it for general practice. But likewise, it makes it more fun.
So I think the biggest surprise for me has been how much I enjoy working in a team. I think it's really easy to forget how many positives that can bring to a job when you're so used to working as an individual. And I've really, really enjoyed that side of it. And it's made work really fun again. I've really enjoyed finding out about my work colleagues, both on a personal and a professional level. And I think it's really important to, all the way through your professional career, recognise what other people can bring to a job in different ways. And again, I think when you work on your own, it's very easy to forget that.
Working in a single team, it's really good because you have lots of people from different backgrounds coming together, bringing a lot of knowledge to one place. And you might have a complex patient to make decisions about. So you have a nurse comes in with their information, you have a GP, it's a better outcome for the patient.
The single team changes things because you've always got access to another clinician, somebody with different skills, different knowledge. So we've got GPs who obviously are a lot more skilled and knowledgeable than myself as a nurse. We've also got other nurses. We've got community nurses who again come from a different side of things really. So it means that we can all pool our expertise and our knowledge and then hopefully have the best outcome for the resident. So yeah, it works really well.
I think the fact that we all work in one room, we have got noise cancelling headphones when we need to be focused, but having half an ear on the conversations, I'm bowled over about the experience and the expertise and what can really be done to make this time in people's lives good.
I think the work that I'm doing now within the Care Hub team is different to what I expected, in the sense that it's much more varied. The actual patient involvement is much deeper than I'd expected. Having worked in a kind of medical model for the last few years, particularly in a hospital environment, what we're doing now is so much more holistic, and it involves discussions about treatment well in advance, discussions about dying, palliative care, involving relatives a lot more, particularly in those patients who don't have the capacity to really discuss their treatment plans. And there's a much more of a holistic approach with the patients that we're dealing with. It's difficult to ascertain exactly what impact my work is having at the moment, other than the individual responses we get from residents or their families or the care homes themselves. I suspect, a sort of a health authority level, they're going to be looking at impact, for example, the reduced number of admissions to hospital in cases where it wasn't appropriate, and I can see there's a necessity for that. But I think the impact on a day-to-day basis is actually knowing that you're adding some value to the care plans of those people you're seeing, and it's not just being done as a tick box exercise. So I think there's the value in seeing that. And only this week we had comments from a patient who died from the family to say that actually it was very well managed, it was very well looked after, and I think that's just as rewarding in many cases, making someone's death a dignified experience, as it is sending someone into hospital to be fixed, because we all die, and doing that in a dignified way is probably just as important. What's the best part of the job? I would say it's probably actually meeting the people, because there's such varied characters and life stories, and the gentleman that I referred to earlier that died, in his last couple of days, I got an insight into his life from his daughter. He showed me photographs of what he was like when he was in his younger days out partying, and then he became a marathon runner and was running marathons at the age of 60, and just an insight into the person, that personality that it wasn't always apparent there when we were seeing him because of his advanced dementia. But I think the interaction with people, I don't say I have my favourites, but there are some people that I go and I've always got a smile on my face when I go and see them, and I say, it's Mrs. So-and-so, I haven't seen her for a week. So I think that's probably the best bit.
I value all of the team. The team it's a bit like a recipe. If you were going to make a fruit cake, you'd have to have all the components to make that cake. You know, every member has a unique task to make sure that, you know, the older people get what they need, whilst they're living in care homes. So I can't value one. I value them all. They're a resource, and it's not a one-man show. You know, you have to have everybody involved, and our team are very dedicated, and I feel very privileged to work with them. The best part of this job is getting to know the people that are coming, you know, the people that you look after, when you think of what they contributed to our world and the difference they've made. And it's really amazing to, when you talk to families and you hear about what they did, who they were, what characters they were, because quite often they're quite different from their middle-aged years or younger years. And it's just that, it's difficult to put into words. Just being able to connect with somebody and provide the need because you've connected is a wonderful thing.
Before this service started, that is with the Care Hub service, we had lots of encounters, problems with GP. It started like, even with the COVID, it's making a double time distress for us. We couldn't have a person actually allocate to us. Luckily, when the service started, we have Alison. She's been doing a wonderful job. We can get to her at any time. We have a special phone number that we can contact her, and she will get back to us as soon as possible. It will take some time, that is the most, but she will get back to us. This service has definitely helped us to do more personalized care, in that the patient wishes can come true. As I said, they don't want to go to the hospital, they want to die here, they want to see the relative. The relative can come here, they can come anytime, and it's more personalized and centered care, definitely. I must say that the Care Hub has been great for us. It has helped us paperwork-wise. All the TEP form we have was like different dates, different time before they take over us, and it's all in place now. And generally, even to end of life, I'm not really talking about end of life case, but all our patient is being seen every week now, and we can change medication, we can take off medication. If they're not comfortable with medication, they will tell us that they need a different type of medication, and it can be changed straight away.
The situation before the service started, we belonged to a very busy surgery, so we would get care for our residents, but we didn't have a ward round very often. It was quite difficult sometimes to get hold of medical care from the surgery because they were so busy. So there was no continuity of care. For care home staff, I think having the confidence that there's someone always there, we'll always get some clinical advice, regular reviews for our residents, and it's given us a lot of confidence. We know that there's always someone to talk to, and that's made a huge difference for us. For patients, it's made such a difference. They get to know the people that are caring from them outside. They have more control over their care. They recognise regular faces that come in, and that gives them confidence to discuss concerns and issues which are really important to them. I think our relationship has changed because we feel that we're listened to. We know our residents really well, so our relationship with the clinical staff has given us confidence to discuss issues that we might not have done before. Really the Care Home Hub for us has been a breath of fresh air. To have a whole team that specialise in frailty has really supported us. We are able to implement advanced care planning, and we do it with confidence now. because we have backup, and that's been wonderful for us.